So welcome to our first national event of 2024 for services who support people with learning disability or mental health. If you're just joining, please note the cameras and mics have been disabled due to large numbers in the call, but there is access to the chat. And if you have any questions for our guest speakers, then please add these to the chat and they'll be here to answer them at the end of the presentation. We'll do our best to answer as many questions as we can, either in the chat or at the end of the session, but if we don't manage to get to them all, we'll send a response out to all those on the call. So this is our Safe Staffing Programme team. We've got oversight from the Chief Nurse, Marie McKenny. Our programme lead is Steph Tom, and we have business support from David Lenny, although poor David's not well and he's not with us today, so he would normally be beavering away in the background, but we are trying to catch up with that ourselves. We have 6 safe staffing advisors divided into adults, children and young people, and early learning and childcare. You can see them on the slide there. So myself, oh, there you are now, Vicky, good, welcome. So myself, Tom and Glo are for the adults team. So normally we would do a poll that would come up on your screen, but with David not here, we weren't quite sure if it would work with us because we didn't set up the meeting. Anyway, we need to brush up our skills maybe, but can I ask you to please answer this one question poll? It's a QR code on the slide there, and I think Glo's going to put in the chat a link to this as well. It's just one question. Are you ready for the Health and Care Staffing Scotland Act's implementation in April 2024? And it's just a multiple choice question. We're going to ask the same question again at the end of the presentation just to measure if there's any difference. This is something that Scottish Government are keen for us to do to measure our impact. I can just see if people are able to get into the polls. Yep, I can see quite a few people are in there already. That's great. Thank you very much. So for our session today, we will update you on some of the work the Safe Staffing Programme is doing. We'll look at the differences between the current and new legislation and consider what will change and what's similar to what you already do. We'll look at the guiding principles and how services will be affected by the Act. I will be joined today by Vicky Moynihan from CME Scotland, and we've also included a video kindly made up for us by the rapporteurs at Include for Good. And we'll finish with a brief look at how the Act will affect the planning and commissioning of services. And finally, we'll try to leave time at the end to answer any questions and complete a brief evaluation. If you've been to previous presentations, there will be a repeat of some of the slides you've seen before, as for some, this will be the first presentation they have attended. However, there's also some new content and our guest speakers, of course. So these are the objectives that we have agreed with Scottish Government for this year. So the first one is increased stakeholder engagement with the whole sector. We've been steadily doing that throughout the piece, and we've really ramped that up in this last year, and especially over the last few months. There's lots of engagement going on, we're pleased to say. The second objective is review and update existing supporting guidance and agree a range of support of resources. So we've updated our page on the hub. We've created distinct pages for adults, CYP and ELC. And these are now, there are now downloadable posters that you can print and display in your service. These are nice and colourful to catch people's attention. And there's other things we're doing, but I'll not tell you about them just now. Maybe at the next one, just in case it doesn't come off as we planned. So we'll wait and see until it's actually happened. The third one is to work with stakeholders to contribute to the development of learning resources. And then we've got a collaborate with stakeholders to complete preliminary work in relation to staffing tool development, specifically for the social care sector. If you've been at previous events, you'll know that we have procured a digital consultancy company called Storm ID. We've now received the draft report from them, and we're just working on an options paper in light of this draft report for Scottish Government. And it'll be up to them then to decide what they're going to do around making a staffing tool, if anything. So we'll just need to wait and see on that one. Number 5 is consult and collaborate with stakeholders to continue the development of a staffing method framework, and Tom will give you an update later in the presentation, and he'll also give you an update on testing the statutory guidance with commissioners. And you'll be able to find details of the work that we completed last year in our end of year report for 22-23, which is available on the Safe Staffing Programme page on the Hub. So just looking at the legislation now, there's 4 parts to the new Act. Part 1, the guiding principles, and Part 3, staffing in care services are relevant to social care. Part 2 is only for NHS. Part 4 is where we find general provisions, which give powers to the Scottish Ministers around enactment of the legislation and to make amendments as necessary. So all care services have a duty to follow Part 1, the guiding principles of the Act, and Part 3, which includes Section 7, which is about appropriate staffing, Section 8, which is staff training and qualifications, and Section 10, subsections 1 and 2, and that's about having regard to any guidance issued by the Scottish Ministers. So that's the statutory guidance that comes along with the Act. There's also specific duties about the development of staffing methods and tools in Chapter 3A of the Act, and this is applicable in the first instance to care homes for adults, then other services as the Scottish Ministers instruct. This slide demonstrates the similarities between the current Regulation 15 and the new legislation. So services still need to fully consider how many staff they need to provide their service. The new legislation does not impose specific staffing levels, and the Care Inspectorate no longer issue staffing schedules. So the similarities as you're reading through should be quite evident. The wording's a bit different, but in general, the ask of the new legislation doesn't differ much from Regulation 15, with the exception of the well-being of staff. And the focus is on staff wellbeing insofar as it affects the main purposes of providing safe and high quality services and ensuring the best care outcomes for service users. And many services already have measures in place to consider staff wellbeing, and we're working with services nationally to identify areas of good practice which meets the requirements of the new legislation. And as I mentioned before, there's also some differences for care homes for adults to do with a staffing method, but at this time they don't impact on the rest of the social care sector. So the first part of the Act tells us about the guiding principles, and these apply to all social care services registered with the Care Inspectorate, every local authority and every integration authority that plans and secures services. So subsection 1A states that the main purposes of staffing for health and care services are to provide safe and high quality services and ensure the best care outcomes for people who use services. The guiding principles continue in section 1B, and there are 8 headings listed on the slide, which must be considered when arranging staffing in any service type. So these principles matter only insofar as is consistent with the main purposes. And most of these headings are similar to the expectations already set out in current legislation, and I'm sure you'll be able to identify many areas of good practice within your own services that already align to these principles. So the health and social care standards support the first principle of improving standards and outcomes for people experiencing care. The second principle of taking account of individual needs, again, is something many services do very well through assessment, care planning and review. There's a wide range of good practice guidance, the Care Inspectorate quality frameworks, the self-evaluation, scrutiny and quality improvement work all support these principles. So we're going to look at staff wellbeing in a bit more detail. So when staff wellbeing is not being taken care of, staff might be more prone to stress, fatigue and burnout. Staff who are unwell will struggle to concentrate or work effectively, reducing the quality of their work. Poor staff wellbeing can increase absence rates due to physical or mental health issues. When staff wellbeing is not prioritised, staff may feel less satisfied, so they might stop trying and they might leave. And importantly, any of this may have negative consequences on care outcomes for people experiencing care. But improvement in staff wellbeing can lead to increased productivity, improved performance, a sustained workforce, better attendance, improved satisfaction, and an increase in morale, making staff more likely to turn up, be engaged, and work more efficiently. And this is more likely to bring about the thing that we're all working in social care to do, and that's to improve outcomes for the people we support, which is one of the main purposes of the Act. In previous events, we have given you examples of what other services are doing to satisfy the requirements of the Act around staff wellbeing. We spoke about things like dedicated wellbeing teams or champions or notice boards, an enhanced staffing area, the importance of being visible and approachable. And we emphasised that the important thing services should be aiming for is that it's safe for staff to raise issues without fear of retribution and that there's a culture of service improvement. We also spoke about how services can evidence the great work you're doing. We mentioned things like using short surveys for staff to see how their shift or their week was, or including staff wellbeing as a standing topic at staff meetings. I'd like to draw your attention on the slide there to an initiative that Perth and Kinross Council are rolling out. So they organise sessions for health and social care staff around Perth and Kinross in collaboration with Tommy Whitelaw from the Alliance. So these sessions take the What Matters to You concept, which is widely used in healthcare for patients. Don't know if you've seen the wee boards above people's beds if you've been visiting anybody. And they ask, that this initiative asks staff the same question, what matters to you? They describe a What Matters to You approach as creating respect, innovation and kindness, which influences our joy in work and in turn makes a difference to the lives of the people we serve. So this work ties in nicely with the staff wellbeing principle of the Health and Care Staff in Scotland Act. So if you live or work in P&K, there are 3 sessions running on Tuesday the 30th of January in Lochleven Health Centre in Kinross. And they're on the slide there. There's a QR code that will take you to them. There's also sessions in Aberfeldy on the 29th of January that I just found out about as well, so I thought I'd mention. But there's nothing to stop you rolling out something like this with your own staff teams, asking them what matters to you. Can lead to interesting discussions. So another organisation doing exciting work that benefits staff wellbeing is CME Scotland. So I'd like to introduce Vicky Moynihan. She's the Project Officer for Health and Social Care with CME Scotland. And they have a national programme to end mental health stigma and discrimination. They'll introduce mental health stigma as a barrier to staff wellbeing, sharing their research and learning on the topic. They will discuss what care services as employers can do to create mental health inclusive workplaces free from stigma and discrimination, and signpost to free support tools and resources to reduce stigma at work. So the image you can see on the slide is taken from their webpage, and you can see that they have a lot going on. So I'll now hand over to Vicky, who will take you through her presentation. So I'll just stop sharing mine. Vicky, if you would like to share away there. It should come off soon.
That's great. Thank you, Helen. Yeah, so I've got a presentation to share. So hopefully you're able to all see that. Almost in slide mode. Not yet. There we go. So hopefully you're all able to see that. You've all disappeared from my screen. So if there are any issues, please somebody just, give me a little shout.
We can see, Vicky, it's all right.
Perfect. Okay, that's always good to know. Okay, so thank you for the introduction and thank you for having me here. So my name is Vicky Moynihan, and like Helen said, I'm a project officer at CME, and we're Scotland's national programme to end mental health stigma and discrimination. And in my role, I've got a specific focus on supporting health and care settings to understand and address stigma. Often that means tackling the stigma that patients or service users can face in healthcare settings, but it can also mean the stigma that staff can experience in these settings when they've got a mental health problem at work. So today we're going to focus in on those kind of staff experiences of mental health stigma, how this affects staff well-being, and what we can do about it. So, CME defines mental health stigma as any negative attitudes or beliefs that are based on a preconception, a misunderstanding, or a fear of mental health. So, back in April 2021, we did some research with about 1,000 Scottish workers, asking them about their experiences of mental health stigma in the workplace. And what we found was that almost half of workers were experiencing a mental health problem at the time. But over a third of these workers, they wouldn't disclose their mental health problem at work because they were afraid of either being discriminated against by their colleagues or because they were afraid of losing their job. About a fifth as well felt that they needed to take time off work for their mental health, but they felt unable to take this time or unable to ask for it. And only a quarter of organisations were encouraging staff to talk openly about their mental health problems at work. And this is data from just a few years ago, and it shows stigma is really a very real and very much still present barrier to people being open about their well-being and about their mental health at work. And ultimately, it's still getting in the way of people getting the support that they need. So to add to that as well, last year CME published the findings from our Scottish mental illness stigma study. And this was a kind of first of its kind piece of research in Scotland, where we explored how people with experience of severe mental illness face stigma across all sorts of different areas of their life. And workplaces came out as a place where people really experience stigma very often, and also a place where stigma had a massive impact on them and in their well-being across their whole life. So here are some of the findings. I won't go through everything, but I'm just going to read that quote in the bottom left-hand corner because I think it really sums up what we're trying to tackle. So one person told us that my manager has been very judgmental of one of our sales assistants' mental health struggles. And as a result, I haven't told anybody about my specific diagnosis or symptoms. So when people have experienced stigma and discrimination at work, whether that's directly themselves or through witnessing how a colleague has been treated, they do remember how that feels. And what this study told us is those experiences, they translate into like really high levels of anticipation. People expect that if they have a problem again, or if they've seen somebody else have a problem and be treated negatively, if they then have that experience of mental ill health, they're also going to be treated negatively. And what this leads to is people withdrawing from the workplace. So 85% of the people who spoke to us, they've stopped themselves applying for jobs because of mental health stigma. 75% have stopped themselves being open about their mental health at work. 45%, so almost half of the people that spoke to us, have resigned from their jobs or they've left the workplace before they were ready to do so because of mental health stigma. And 64% stopped themselves asking for flexible working or some other sort of reasonable adjustments. So overall, people experiencing and witnessing stigma and discrimination, they're less likely to apply for jobs, less likely to apply for promotions, less likely to speak up and ask for help when they need it, and more likely to leave employment prematurely. So we know mental health stigma is prevalent. We know it really impacts on staff well-being. But why do we really need to focus on addressing stigma when, well, there are so many other competing challenges and competing fires to fight in health and care organisations? Right, well, poor mental health is costly. It costs UK employers about 56 billion or so per year. And presenteeism as well from mental ill health, that costs the UK economy about 15 billion per year. And that's actually almost twice the cost of actual absence from work. So really, really costly. And stigma is a big factor across all of this. So stigma leads to higher rates of long-term sickness absence in employees because, well, when people are reluctant to speak up and ask for support at the first signs that they're struggling, they're then more likely to go longer before they access help. They become more unwell in that time and can take a lot longer to recover and get back to work. Stigma also gets in the way of retaining staff. A big finding for us was that often employees feel it's the easier option to just leave the workplace rather than to disclose a mental health condition. And also importantly for the care sector as well, stigma can impact on somebody's quality of work. So in care, that could be the quality of care that's provided to a patient or a service user. Then people are pushing themselves really to continue working when what they really need to be doing is taking some of that time off to rest and recover and get better. So often we get employers coming to us and they're doing absolutely great work on staff well-being and on staff mental health and putting all of these well-being interventions in place, but they're struggling to understand why their colleagues aren't engaging with this and why these supports aren't being very useful. Honestly, the answer often comes back to the same thing, and that's that tackling stigma and discrimination, it's absolutely foundational to any action to improve mental health. So you can have all of the helplines, all of the counselling sessions, all of the mental health first aiders in the world, but if stigma is still present and people feel like they can't talk about their mental health, they can't ask for help, then those efforts are likely to be a lot less effective. So I want to just take a minute and share a very short video that was recorded by one of our volunteers, Chick, and he's talking about his experiences of stigma in the workplace and what we can do to address it. So I am actually gonna stop sharing and start sharing again, if that's okay.
My name is Chick Duncan, and I'm a media volunteer with CME. I have a severely debilitating mental health condition, which, according to the World Health Organization, is up there in the top 10. My condition is obsessive compulsive disorder. And in my case, it does involve a lot of washing and cleaning and avoiding touching things. Other people can have other sorts of ideas, intrusive thoughts, this sort of thing. It can impact very suddenly, so that I might drop something on the floor and then not be able to pick it up because it's not clean. And that can be very awkward in an employment situation. Somebody else might drop something on the floor and then want me to sign it, for example. Those kind of situations in a formal employment situation can be very difficult. I visited Burness Paul, a legal organisation here in Glasgow, and they were looking for somebody to come in and talk about lived experience. So I went in there, spent, I don't know, maybe an hour or so, just talking about my own life, the background and so on, how my mental health has affected what I've done and what I've not been able to do. But the other side of that coin is that I have worked part-time as an IT tutor at Glasgow University, an IT tutor in community education. I've been a web designer. Employers in particular who have to make those decisions about who you're going to employ and how you're going to employ them, try and find out a wee bit about what the condition is, what it involves, and what it doesn't involve. They'll get rid of the myths about it. Other staff, I suppose you're just hoping for people to be compassionate, and considerate if you're struggling a wee bit, to support you or even just leave you alone if that's what's necessary, So, for example, you might have someone who would benefit from flexible working, or somebody who would benefit from job share, or somebody who would benefit from being able to just phone in and say, look, I'm not too good today, can I just work from home? I've got my laptop set up or whatever. As soon as you know that that's there, you're being supported. And that confidence, if you like, that people are supporting you and so that's crucial. If you don't see past the stigma, you never know what you're missing. You could be missing a potential employee of the year. You could be missing somebody who could save your company thousands or even more. See past the stigma. You don't know, A, in terms of the potential of the person, B, in the productivity potential, and also in terms of the financial potential that this person might bring to your company.
Okay, so Chick, I know, is talking about quite a different sector, and I know that not everything that he said will translate to the care sector. So some things like working from home might be a bit more challenging in the care sector. But the key message is still the same. It's about listening to the person, working with them to understand their condition, and together finding solutions that work for both the employee and the employer. And you're not alone in this. There is loads of information and support out there to help you tackle stigma across organizations. There's actually a whole field of research that's dedicated to finding ways to tackle mental health stigma in work. And at CMU, we've worked quite hard to combine this research and bring it together with our own knowledge after years of working with employers across Scotland and surveying thousands of employees at all different sorts of levels of organizations. And we've put this into 7 key building blocks for creating stigma-free workplaces. And we've used these to develop our CME and Work programme. This is a whole programme of kind of tools and resources that allow employers in Scotland to fairly easily apply what we know works. I won't go into all of them just now, but you can find more information on our website along with lots of kind of helpful videos and things to get to grips with this. And it is really important to take a whole organizational approach and go through these building blocks. But I know that can feel like quite a big piece of work for a lot of organizations, especially if you're pressured in other areas. So let's also just look at some resources that might help. So for those of you that get how important stigma is to tackling mental health stigma, and supporting staff well-being, but maybe you're struggling to make the case to senior leaders in the organization, we've got some kind of specific tools and resources that might help you do this. So there will be links on the slides, which I'm happy to share afterwards. But there's a brief that sets out the legal, moral and business case for tackling stigma. There's also the UK Government Thriving at Work report, and that sort of breaks down the financial cost of poor mental health at work. So really, really useful. We've got a cost calculator that does that as well. And there's a few briefs and videos and things and tools about our CME and Work programme, which is totally free, by the way. And yeah, can be really useful for an organisation to take on to kind of make those steps towards tackling stigma at work. These are also some of our most requested resources. So we've got a set of e-learning modules on how to reduce stigma in the workplace. We've also got our Let's Chat tool, which provides guidance for managers to talk to their employees about mental health. Got a Spotlight On series and case studies, and also some campaigns that you can take part in. And these campaigns, they can be a really great starting point as well if you're just kind of looking to dip your toes into kind of tackling stigma at work as a first point. So we've got coming up on the 1st of February, Time to Talk Day 2024. And that's a national day of conversation about mental health stigma. And you can do kind of whatever you want really for that, but we've got lots of activity packs if you want to kind of have coffee mornings and other kind of little activities at work as well. That's a really nice place to start. So yeah, there's lots out there. I will share links and I will share the slides, but also I'll pop my email address in the chat because we're more than happy to talk to kind of anybody who's interested in taking on some of this work, no matter how big or small, or also whatever level of your organization you're at. So yeah, I'd be really happy to chat to anybody afterwards that's interested in this. I think that's all from me right now.
Thank you very much. It's really interesting and thought-provoking, and I'm sure you'll get some questions later on. You're getting some applause and hearts coming up. That's well done. Thank you so much. So Vicky will be available for questions at the end of the presentation, and I know your cameras and mics are disabled, but if you put questions in the chat and then we can direct them to her. Okay, so just moving on back to the legislation. So this is the duty on care service providers to ensure appropriate staffing. So as we said earlier, the new legislation doesn't impose specific staffing levels. So when determining what constitutes appropriate staffing levels, Section 7 tells us that care services should consider the nature of the care service. That's just the type of service that you are. Is it a care home or care at home or a nursing agency or something else? The size of the care service, so if you're care at home, you might be operating in a small area or covering several localities. The aims and objectives, these are the aims and objectives that have been agreed at the point of registration with the Care Inspectorate. The number of people who use the service and the needs of those people. So you're the experts on this. You know that if you're supporting 10 people who are independently mobile, they're continent with little stress or distress reactions, it's likely you may need a different staff complement than for 10 people who require assistance to move around, including going to the toilet, and require a lot of reassurance or diversion to reduce stress and distress reactions. Section 8 of the Act states that any person who provides a care service must ensure that individuals working in that care service receive appropriate training for the work they are to perform and suitable assistance, including time off work, for the purpose of obtaining further qualifications appropriate to their work. There's a learning resource, some of you will be aware, on TURAS. It's the Knowledge and Skills Framework for Health and Care Staffing in Scotland. Level 1 is the informed level, and that's suitable for all staff. There's 4 short videos which provide a foundation level of knowledge of the legislative requirements and workload and workforce planning. Level 2, the skilled level, is aimed at team leaders, and it's a suite of 4 modules providing a more in-depth look at the legislative requirements and a clear, applicable understanding of workload and workforce planning methodology. So we're going to move on now. The Safe Staffing Programme have been working with Include for Good, a programme supported by the Scottish Commission for People with Learning Disabilities. Include for Good is co-produced and led by a team of rapporteurs who are people with a learning disability championing, I'm not good at saying that word, change across Scotland. They identified 8 pillars they're focusing on and have linked staffing to some of the pillars in a short video the team kindly made for us. We are excited about this piece of bespoke work and are happy to now launch the finished video. So thank you to the rapporteurs who took part in this video, John G, Natalie and John K, for taking the time to do this and for putting together such a great video. We really appreciate it, and thanks also to Jeannie Clough, who's programme lead at Include for Good, for her enthusiasm and facilitation of this work.
The Include for Good rapporteurs are all experts by experience, working to make Scotland a better place for people with learning disabilities. They have identified 8 pillars where people with learning disabilities are not getting their human rights met. John G lives in a supported housing setting and has 10 hours of support a week. Natalie lives in a care home with support to get up, dressed, to prepare meals and with personal care. John Kay has his own tenancy and 24-hour support from a mixture of direct support staff and technology. They want to talk to you about lifelong support.
Human rights are for all. They are not anyone else's to give, but we need good support to get our human rights.
The health and social care standards are there to make sure our human rights are met.
Good communication is essential. When there are staff shortages, my support tends to be pulled. This has a huge impact as routine is so important to my day-to-day life. Being sociable is so important to me, but I am isolated without support. Mental health can really suffer when someone is isolated. Changes to my support also make me feel really worried and anxious. These changes are not often communicated to me. This makes me feel angry because it feels like I am not important enough to be communicated with. I don't feel like I'm an equal human being. I don't feel respected. I have the right to live independently and to be included in the community. Without good staffing, I soon lose these rights.
Employment is really important to me. I live for my work. It helps me feel part of society and allows me to be part of making change happen for current and future generations of people with learning disabilities. Yet, too often I have had staff question my ability to work, and many fail to see the value of work to me and the value to society of my having a job. This attitude has led me to nearly miss work or to arrive unwashed or hungry on more than one occasion. On the day I was speaking at Parliament, I had someone that did not know my routine helping me to get ready. This was the most important day of my working life, yet I didn't get to wash or eat or get my hair done and went out without a coat on a cold day. I felt like I had no dignity or respect. I feel this way so often. My mental health really suffers. I have the right to employment and to an equal standard of care as someone without a disability, and I have the right to be free from degrading treatment, but without the right staff, I soon lose these rights.
Well, the right staff can be very different. It's not just about school, it's about family. Kids to get to know us. They get your it's about us. It's not about that. It needs to be done. Believe on us. There are more faces and help us to go and look for opportunities to go and the family and meet the outcome we want to achieve. Getting the right stuff means involving us and with equipment and forming and raising a support plan and seeing a staff pushing us and so and we have the final who's and a staff team.
The right staff respect us, they are reliable, consistent, and trustworthy.
We know who I'll be working for, each day, the impact of having this we can get to work and see what we want. Let's make us feel good and we can be ourselves.
When there are staff shortages, this good work gets lost.
Far too often I have had things come in to support me.
Often they are not confident in using my equipment.
What makes me feel unsafe. I feel scared and formal.
We understand the challenges of a staffing crisis. Please remember, though, the impact this crisis has on us. Do not let this become the norm in social care. Thank you for listening.
Well, I'm sure you can appreciate that it's not easy telling your story to the nation, especially during a staffing crisis. So I want to say I appreciate the bravery of the rapporteurs and their motivation to champion change throughout Scotland. Natalie can't be with us today, but John G, John K and Jeannie, as you can see, are all on the call today. So I was going to say we hope you could join us in giving them a virtual round of applause, but you're already there, so that's lovely. And they will be available for questions at the end of this presentation. I see people with their hand up. Unfortunately, the cameras and mics are disabled. If you weren't here at the beginning, you maybe not know that. It's just because of the large numbers on the call today, but you can use the chat function. So I'm going to hand over to my colleague, Tom, who's going to take you through the remainder of the presentation.
Yes, thank you, Helen, and hello, everybody. So I just wanted to briefly talk to you about two more important parts of this new staffing legislation. One is a thing that is called a staffing method. And what the legislation there says is it tasks the care inspector to work with the social care sector, starting with care homes for adults, to develop this thing called a staffing method. And essentially what it is it is like an extended larger piece of guidance that takes the principles that Helen spoke about earlier on, the two main purposes of the Act, staffing being outcome focused as the most important one, and the 8 main principles, and puts a bit of beef on it, if you so wish. So basically, a staffing method gives staff instructions as to how they can do that. It gives them a rationale for each of those principles. And also what we have included in it are some good practice examples from the relevant sector, in this case adult care homes, that are from practitioners and that tell other people how they can implement the staffing assessment and planning in a way that is compliant with the Act. So where we are with that just now, with the staffing method framework for adult care homes, is that currently, as we speak, 20 care homes across Scotland, from very rural areas to inner city, are testing this out until round about end of February. So they're working with the document, they're seeing how it works for them and if it helps them. And most importantly, they might come up with more and maybe even better good practice examples that we can include in the final version. And once we're finished with this work and we've produced a final version of this, then this will at least be available as guidance that adult care homes should refer to. There is an option in the legislation to make a staffing method a requirement, but that's all a little bit complicated and that might still be further down the road and certainly not be the case from the 1st of April. After that, it is likely that work will continue to also look at other service types, so like care at home, housing support, and whatever else there is, and give each service type their own specific staffing method, although obviously the principles are the same, so they'll all be quite similar, but there might be some more specific good practice examples in them. However, if you don't work from April in a service that is a care home for adults, this document, once it is finished, will still be helpful because it does help particularly managers and staff to do with planning and assessing staffing. It does really help to understand what the legislation means with the main principles and the various paths and how to implement it. So that's the staffing method. And the other thing I wanted to briefly speak about is the reporting duties, and in particular the reporting duties and the duties for commissioning teams and HSCPs. So one of the things that will hopefully be a good thing about this legislation is that there is a yearly reporting function built in. So that means starting with April 2025, every year, relevant Scottish ministers for healthcare and care need to report back to the Scottish Parliament how this is all working and if it is working. And there can be scrutiny to that in Parliament. So that's potentially a good thing, because at the moment, obviously, there is no regular discussion of staffing in health and social care that comes back every year to Parliament. And then a very important part of this reporting function is information that will come from health and social care partnerships, and particularly the commissioning teams. They've got a duty to report to the ministers every year. And they've also got a duty to ensure that any contract frameworks or any care that they buy or commission out there, that the services they commission comply with the staffing legislation and the principles of the legislation. And then they do that and then report on a yearly basis about how that is going. And they also will report on any potential risks or problems that there are with services complying with this legislation. And again, that is something that we're still in the process of testing with health and social care partnerships across Scotland at the moment. That work will also slowly come to an end middle of next month. But what we can already see from that work is that increasingly the commissioning teams in the health and social care partnerships are well prepared. They're putting training in, they're sorting out how to set up their terms and conditions accordingly and how to monitor services compliance after April. And that was my little part. I think the next thing is Glo will try and put another survey up, and I will hand over to Helen. Thank you.
Thanks, Tom. Yeah, so I mentioned at the beginning that we would be asking you to complete the same poll again. So if you don't mind, please go ahead and do that. I can see some people are in it already. We've got 3 responses so far. If you don't mind, just go in using the QR code, or Glo's put the link in the chat, and just answer that same question. That's grand. Thank you very much. Okie dokie. Now that's just a wee mention for some events that we're holding regionally. We can't get around the whole of Scotland, unfortunately. We're a small team, so we've picked 6 areas where hopefully it's accessible for most people, or you can get to fairly easily by public transport. So there's QR codes there, and these are all advertised on our page on the Hub. So if you want to go, you can register for the events. There's going to be 2 events, one for ELC and CYP, and then one for adults. So the adult ones, you can see the times advertised on the slide there. So please do register. It's first come, first served. There's 100 spots, around about 100 spots for most places. Some are a little bit smaller, the venues, but around about that anyway. And these are our contact details, and there's a link here to our evaluation forum. Can I ask you, I think Glo could maybe put that in the chat, and we're just going to move swiftly on to see if anyone's got any questions for any of our guest speakers today. Glo, was there any questions in the chat for any of the speakers?
The questions revolved around just how we're going to make the presentation in its entirety available to people, and that includes both video and the presentation video as well. Lots of recognition came in very positively from one of the quotes, which was, if you don't see past the stigma, you don't see what you're missing. And people thought that was just a fantastic quote. And again, for the Include for Good, people were saying what an amazing video, and really lots of praise for John and Natalie and everyone who was involved in that, and asking if that can be available as well. So Jeannie kindly put a link in for Include for Good so that people can get that. And with regards to the whole video, I obviously advised people it would go through our comms department, and then it would be made available for people to load down in their own environment. So we just have had one question has just come in to say that for one individual, you know, working with strict guidelines, manages an adult daycare centre for disabilities, and the thing you're discussing, we already do. So I'll let you answer that, Helen, because that's a really good point.
So not sure what else is expected.
Yeah.
You know, if you're already doing satisfying the requirements of the new legislation, then that is absolutely fantastic. Keep doing it. You know that if you're already there, we're not expecting you to do anything else. You know, I guess just paying heed to what our guest speakers were saying today, and just keep reflecting on, is that still the case? And asking yourself, how do I know we're already doing that? You know, who have I spoken to? And making sure that it's everyone's included, everyone's consulted, or at least given the opportunity to be consulted in a way that maybe works for them. So I guess having a variety of ways where people can be consulted as well, and just making sure, just reflecting back and making sure that if you're already hitting the mark, that you continue to do that, and that you're aware of how you know that. Okay. Any other questions? Or would anyone else, I mean, any of our guest speakers are welcome to come in with any points as well. I mean, I think you all did an amazing job, and there's obviously been lots of food for thought, and the videos were fantastic, both of them. Just looking, there's lots of praise, and see Vicky's put the link in again for Chick's video. So I mean, these are really great tools to use with your staff team as well to have discussion. Anyone got any questions? Now's your chance.
I'd just like to echo what you're saying, Helen, about the videos for resources, starting points for discussions. The rapporteurs are more than happy for people to make use of the video. That's why we've, you know, a major aim of the Include for Good programme is to get the message out as widely as possible. So sharing the video with other people would be really beneficial.
I guess I have one question for either yourself, Jeannie, or either John, and that's really just I see some similarities between your programme and ours, because we are also a small team working on a national programme, like to make national change, and it can be quite daunting. I'm wondering how that feels or how you cope with that.
I'll maybe invite the two Johns to come in on that, but from my perspective, I think I'm the one that's daunted. The rapporteurs aren't daunted, because I think the reality of living life, if you don't get these issues resolved, is much more daunting than the coming and telling people your story. And we are really conscious that you know, what you've heard, some of it was really difficult to listen to. It's even harder for people to share that and to tell their stories. But you know, we're always really conscious that it's down to the rapporteurs what they choose to share, and we do, you know, sort of talk around, you know, how comfortable are you with that? You know, this can be out there for years to come, but you know, I think as a team they feel just very, very strongly about how important it is that people do hear from them. But I would say they're not daunted at all. But John Gallen, I saw you put your microphone off. Do you want to jump in?
Yeah, the reason why we've created this programme, because we've been to constant meetings and, you know, with government, and basically it's coming out one year and it's coming out the next year, and there's been no feedback from that. And we've challenged it, you know, a lot over our lives, you know, to getting, you know, a better place for people with disabilities, because that's what we want. We don't want to be discriminated. We don't want these barriers, you know, to prevent, you know, to happen again. So we're trying to reach out to many organisations, as you guys today, you know, to reach out, you know, to tell you what needs to change, and you know, and what could we do to support you with that.
Brilliant, thank you. I'm very aware of the time. If you need to leave, please do. I see someone's got their hand up. Unfortunately, the mics and cameras are disabled. But if you do have a question, then please do put it in the chat. We could maybe, if everyone's okay, just take like a minute longer just to let that person put their question in the chat, if that's all right. But yes, someone's saying, well said, John G, and a big smiley face. Absolutely well said. Vicky, do you have any final points that you would like to make? Not to put you in the spot, sorry.
No, you're okay. Nothing major, just that I think the work you're trying to do here is absolutely fantastic, and I'm also blown away by the rapporteur's video. Like, that is such a powerful piece of work, so massive well done to everybody involved in that. I mean, I know how hard it can be to produce these kind of things, so yeah, huge well done there. Yeah, just a final, I guess, note just from us that all the resources we offer as well are free. So I don't know if I mentioned that before, but I guess it's an important point to say. So if anyone is thinking about doing any kind of work on mental health stigma as part of your kind of staffing well-being actions, then yeah, please check that out. And get in touch. We're more than happy to support you to kind of find whatever is kind of best tailored to you and your workplace. But yeah, just great event and great work from everybody. So thanks.
Well, thanks, Vicky. And on that note, I think I don't see any more questions in the chat, so I'm going to say a huge thank you to our guest speakers. It's very much appreciated. And yeah, I'm sure we'll stay in touch. Might be inviting you to other things. If that was all right, we'll have a chat. Great, good stuff. Well, thanks everybody for coming today. You know where we are. If you need to get in touch, please do, and we'll see you all later. So take care, enjoy the rest of your day. Stay safe if you're driving. Okay, bye-bye.